mind sharing with our group the story about your mom? You know, you talked about how your mom was at a stage where she was going to have some work done and what you originally thought. Will you kind of share that story with me again?
Sure. My parents live in Gainesville, Florida. That's where I was born and raised. And it's a small college town. Go Gators. And I'm here in Miami now. And now she needed some almost kind of routine dentistry. And so she came down, drove down, and it's a long drive, 6.5 hours for them each way. And it turned out that it's not routine, that some of these teeth that she thought were routine, they really need to start coming out and such. So
can relate to that.
Yeah, so we said, okay, we'll take them out and we'll socket preserve. I'll do bilateral sinus lifts, I'll do bone grafting. That's what my earlier books, that's what they've been on, bone grafting. That's what my seminars and teachings and courses and lectures have been on. And that's what my expertise is on. That's what I'm known for. So I said, okay, we're gonna do the bone grafts. And then after that, we'll put in the implants. And we'll put in 8 or 10 implants and maybe 12 and have individual crowns or bridges. And we're gonna perform this at the highest level, the level that I know I'm capable of, and the level I would offer to someone with unlimited budget is subsequent to that. So we planned it all out and we're gonna get started with this. And subsequent to that, a good friend of hers came down, and that good friend, I spoke to them and I said, well, what would be easy for you is to take out the 5 remaining teeth and doing the tilted implants, the full arch implant rehabilitation, as we call it, concept, and giving an immediate prosthesis that day that's screwed in, and then you come back down after that, or in Gainesville you get done a definitive prosthesis 6 months later. Mm-hmm. So it's essentially one trip with me, or possibly several more, but essentially one trip. And she was here for the consult. She said, you know what, if you can squeeze me in, I'll get it done while I'm down here. I said, great. Okay. And she came on Monday. I said, if you don't mind, I do need a couple of days just to free up my schedule, but I'll get you in for Friday afternoon. Same trip, took out the 5 teeth, put in the implants, put in a prosthesis, screwed in. She went back better than she had come.
Right.
Mom came down. We took out her bad teeth. She had more than 5. She had a lot more. Took all those out, socket preserved, and gave her a denture. That's a classic way of doing it.
Sure.
Gave her a denture. They both go to Gainesville, and my mom's comparing notes. Said, wait a minute, I take mine out every night. I sleep here, and my teeth sleep here. Like, oh. And you sleep here, and your teeth sleep there.
Yeah.
And it's my son. My mom was so confused about that.
Wow.
And I tried to explain to her that, Mom, I'm trying to give you is at this level. In her mind, what her friend had was at that level, one visit, and she was done.
Was actually at the better level.
Yes.
Because it was more convenient.
Yes.
And okay, so.
Okay. And my mom she's not a fearful patient. It wasn't multiple procedures from that perspective. Although for some of them, the same reason, it could be one procedure as opposed to multiple surgeries.
Yeah.
Okay, but in her case, one procedure for convenience factor.
Yeah.
And she asked me, and so we switched gears. And I said, okay, we'll do this next time you come down. I'll give you the tilted implants. We'll put the prosthesis, and that's what she's getting. And she's got the transitional in now. The definitive from Pinas Adar in Atlanta has already been shipped down. It's in my office now. She just needs one trip down, and the definitive will be screwed in the next several weeks. For her.
That's awesome.
So it's 2 trips.
I need to let him know when I talk to him next, because I talked to him a couple days ago, Bernard, to say, that's cool. I love how these dots connect. So your mom, having access to you, which is a very high-level clinician, could have had what some people might say is the Rolls Royce, individuals, all that kind of good stuff.
And that was her treatment plan.
Yeah, and yet then she saw what her friend went through and what you were able to do for her friend and said, I want that.
Yeah.
And you gave her that.
Yeah.
And she's happy.
It is more happy. And what I realize is, and realize prior to that also, but we have to realize that is we can't apply our biases from the patient's perspective. We look at is from their perspective. We've always got to be treating them and their particular circumstances, not their mouth, but the human being. And the human being attached to that mouth is someone that doesn't want to drive 6.5 hours each way multiple times, would like to do it in as few visits as possible. That's the human being attached to that mouth.